Hi, buddy! Hi, kumusta?
It is our responsibility to protect the vulnerable members of society, our children. We protect our children from dangerous people and dangerous places. We also try to protect our children's health. The last thing we want for our children is for them to catch a disease like measles, mumps, whooping cough, chickenpox, or polio. Scientists have created vaccines that have been proven to prevent these diseases. Immunization by vaccines currently prevents 2 to 3 million deaths per year according to the World Health Organization. In the 20th century, there were over 29,000 deaths from smallpox yearly in the United States. By 2012, that number dropped to 0. Even though there is now access to vaccinations and science has proven their safety and effectiveness, there is a population of parents that choose not to vaccinate their children, leading to outbreaks all over the country.
The Centers for Disease Control and Prevention says the nation is facing its largest measles outbreak in 5 years. On Tuesday, New York City Mayor Bill de Blasio declared a public health emergency
where measles, once declared eradicated in the United States.
Well, the measles outbreak
At near record levels.
Measles outbreaks are rattling regions of the country again this year.
To prevent these outbreaks, state governments should eliminate personal and religious exemptions for vaccinations to maintain herd immunity. Those that do not comply would be required to attend vaccine education sessions at their own cost, and their unvaccinated children would be barred from attending school. Herd immunity is when those that aren't vaccinated are protected from an infectious disease if a large percentage of the population has become immune to the infection.
In order for a community to have herd immunity or community immunity, we have to have 80 to 90% of the children vaccinated. The little percent that's left could be for kids who have possible allergies to.
Even though a small percentage of children can develop an allergic reaction to a vaccine, it is always treatable with proper medical care, unlike the disease that the vaccine prevents against. Misinformation has fueled the opinions of parents that choose not to vaccinate their children. A common misconception is that vaccines cause some children to develop autism.
It absolutely does not cause autism, and that's been proven scientifically.
This myth stems from a study published in 1998 by Andrew Wakefield. This study was soon proven to be highly inaccurate and since has been discredited due to an incredible amount of procedural errors, undisclosed financial conflicts of interest, and ethical violations. Andrew Wakefield lost his medical license.
So no study has ever shown that vaccines cause autism, period.
Religious beliefs are another factor for some anti-vaxxers. Freedom of religion is part of the Constitution of the United States, but as the New York Times states it, infecting people isn't a religious right. There are still 47 states that allow non-medical exemptions from vaccines. All of these states tend to have a higher percentage of outbreaks. We cannot keep letting these outbreaks happen. Just like buckling up your child, vaccinations will protect them from the worst case scenario, even though it isn't bound to happen.
It's our moral responsibility to not let kids go to a public school or a private school if they haven't been vaccinated, that we have a responsibility to society as a whole. Our government has the responsibility to protect citizens and to do what's right for the largest percentage of people.
It all goes back to protecting the entire community. I think back to about 4 or 5 years ago, we had a student with leukemia and obviously on very heavy medications at huge risk for any kind of virus that he could have caught. So the idea that it would be unethical for the public school to protect that student it just doesn't make sense to me. That's our job, is to protect all students. So when it has to do with protecting someone's health, that's just the only ethical decision to me.
By meeting the threshold for herd immunity, we're able to protect the most vulnerable members of our society. We can achieve this by instituting a policy where parents who fail to vaccinate their children are fined and required to attend informative seminars at their own cost. This would be followed by mandatory vaccinations by a healthcare professional. These are the important strides we must take to protect the health and well-being of future generations.
Aw, thank you, Sean. Love you.
Love you.